Good morning, happy Friday, and welcome to our informational webinar related to the ESP data submission experiences. We will get started in just a couple of minutes. We want to let most of our attendees have a chance to get on and make sure their sound and everything is working properly. So we'll be right with you in just a couple. All right. What do you think? Should we get started? All right. So as I mentioned, good morning and welcome. Welcome to our webinar regarding the experiences folks are having with the ESP data submission process and decisions whether to submit or not. I will start with introductions on the next slide. I am Jim Donnelly. I'm president of Hudson Headwaters 340B. Joining me today and doing most of the heavy lifting will be Rachel Sari, our manager of client relations, and Beth Lagan, our operations program manager. Rachel and Beth have more of the frontline experience with their team members handling the ESP process on behalf of our clients. They're intimately involved with this with the team as we help where we can as our clients consider and attempt to share data with ESP and regain access to 340B pricing in various environments. Let's say that they are the boots on this shaky ground of ESP data submission. So I'm really happy to have them with me today. If you've attended the August presentation that we did on the same topic, it may look very familiar. We've added some updates, but we're also offering this to a much wider audience today. And we're happy to do so by popular demand. While the information shared highlights, some of our TPA processes, we feel it's valuable for any covered entity or vendor in this space. Attendees may learn some new areas to keep their close eyes on, or they may look for improvements that other vendors can apply as well. The 340B program, from my perspective, is only as strong as the weakest links in the process. So we pride ourselves in collaboration to strengthen that chain with as many opportunities as we can. Feel free to send questions through the chat. We have slides at the end where we've added the questions that have come in through registration up through yesterday. But any other additional questions we will try to answer as time permits. So here's our ambitious agenda for today. Our goal today is to set the stage for those who may be somewhat unfamiliar with the ESP reporting process and may have been reluctant to share data. Now, as we approach, the Halloween time here, things are a little scary, and things can be scary when it comes to submitting your data to ESP. And we'll talk through some of those concerns. We'll also talk through the challenges involved in the process and what we can do to help and what is out of our control. The decision on whether to report data to the manufacturers through the ESP platform is for each entity to make. We do not we don't take a stand on either side of this decision. Each entity has their own financial impacts to assess and their own risks of reporting to weigh as well. There are legal considerations that you really want to pay attention to. We will highlight certain areas, but we certainly are not offering legal advice. We cannot do that. We will highlight, as I mentioned, though, some important considerations along the way, which may help you and your organization in your decision-making process. A good portion of what we will discuss today will be centered around the submission challenges, the experiences that entities have had in regaining the 340B pricing that has been withheld by manufacturers. And we will conclude with our open discussion for all to ask questions, but also to share experiences that you think might be valuable for others after we cover the intended information. Before I turn it over to Beth to outline the current manufacturer restrictions and their nuances, let me just give you a little bit of background on the company contracted by manufacturers to collect the data. The Berkeley Research Group, BRG, is the owner and founder of ESP Second Sight Solutions. BRG has issued many reports in the past critical of 340B. Entities should do research on previous BRG 340B related articles to have a better understanding of what the data may be used for. BRG is a manufacturing partner. They are not a covered entity partner or have not been in the past. As Maureen Testoni, president of 340B Health, describes the arrangement as BRG being in control of the 340B data is like the fox guarding the hen house, and I don't disagree with that. We do, however, understand the situation that entities are in, the difficult decisions that they have to make, and we're willing to assist wherever we're asked. With that, please keep in mind that you are sharing data with BRG, and we'll talk about what that could mean downstream. We know that the financial pinch is serious. Some have expressed that it's a form of extortion. It could be interpreted that way. So you have, in some cases, no choice because of the financial impact of what's being withheld. But that's, again, the decision that the entities have to make. So we'll talk through the current situation that we're faced with. And with that, here's Beth.
Good morning, everyone. Welcome. So the first two slides that we're going to go through offer a quick view of the current manufacturer environment. As of today, 18 manufacturers have implemented integrity initiatives. They each have their own nuances, and all but two, AstraZeneca and Novo Nordisk, are partnered with the 340B ESP platform. To summarize these initiatives, the manufacturer determines what entity types the restriction or initiative is applicable to, the date that the initiative begins, and the products that are bundled underneath the initiative. They can also add additional layers. So some of the more recent-ish ones are the 45-day rule, where the fill date must be within 45 days of the time you're submitting the data in order to receive 340B pricing. So changes to the NDC list or additional layered rules can be applied at any time without warning, sometimes without public notice, and it makes analysis on the entirety of the process really critical to maintain your 340B benefit. All involved in the landscape are navigating the initiatives, manufacturers, wholesalers, contract pharmacies, the covered entities, TPAs, gateways, the whole gamut. So today we're going to walk through some of those pieces, and I'm going to turn it over to Rachel now.
Good morning, everyone. Thank you for joining us today. So this slide represents the workflow of how the Hudson 340B team handles the manufacturer exclusions, or attacks, as we like to call them internally. When notified of a new initiative, an internal analysis of impacted NDCs is completed using both the letter that was sent by the manufacturer and, if applicable, the list of NDCs on the ESP website. If we have any questions, Hudson 340B will reach out to the manufacturer or ESP for further clarifications on behalf of our clients. Hudson 340B applies the qualifying and ordering blocks within our software, beginning with the start date of the initiative. Before the effective date, our client success analysts, or CSAs as we like to call them, process all available data and place orders on available inventory to ensure maximum available replenishment is completed before the initiative is taken into effect. The CSAs provide a summary of 6 months worth of data by manufacturer broken down to pharmacy level to each client. The analysis allows entities to review if designating a single contract pharmacy or submitting data to ESP may be worthwhile. Our internal team communicates with gateway partners to prevent further replenishment on effective date. We also notify these partners if any clients have been submitting data or utilizing one contract pharmacy so purchasing can resume and stay in place. Lastly, our vendor team monitors purchases to identify if purchasing is taking place at 340B price. And we'll talk about that with more to come. And then this, sorry. So this slide represents an example of a pivot table provided for manufacturer impact analysis. The summary provides a roll-up of the past 6 months of eligible dispenses by store and NDC. The estimated margin or benefit gives the client perspective of the impact and again allows them to make a data-driven decision for designating single contract pharmacies or deciding whether or not they would like to submit the data. I'm going to pass it back to Beth, or Jim, sorry. Jim's next.
Thank you, Rachel. So you're at the point where you're considering submitting data. So what should some of the key considerations be for your organization? As mentioned in the intro, we cannot provide legal advice, but we can caution you on some of the things that require careful attention. Check first with your pharmacies and your vendors to make sure that the sharing of the requested data is not in any way in violation with those agreements. Pay close attention to the ESP user agreement. This is critical. It is very one-sided, and I'll have some text that you can take a look at just as an illustration of this in the next slide. The entity should have legal review of this agreement before you decide whether you're going to upload information or not. Another question is, will submitting this data result in reduced reimbursement for the pharmacies downstream? We have no way of knowing this specifically at this point in time. However, you do want to pay close attention to this. One thing that I like to tell entities is talk to your pharmacies about it. What are their thoughts? I mean, this is a topic of conversation throughout the stakeholders in the 340B space. They may have more visibility or more thoughts on the reimbursement methodologies, their contracts, but be conscious of the fee structures that you have in place as well. If reimbursement is reduced and you have fees that are based on reimbursement, your fees will go down. That's probably a good thing to make sure that it's appropriate as you lose benefit downstream if that's possible. But just pay attention as things may shift in the future. I'm not saying that they will. I think one of the best things that we all can do is get involved at the state level with advocacy and make sure that we understand some of the legislation that is being worked on to prevent discriminatory reimbursement for our pharmacies to protect us from downstream effect. Manufacturers, though, keep in mind, are requiring this data submission not just on Medicaid claims. This is submission that's across all commercial payers, and what they want to do with this is to reduce the rebates that they're paying to the PBMs, which would affect potentially downstream the amount of money that the payers are getting, and they may work to reduce the reimbursement to the pharmacies, or even go a step further and remove covered entities in their pharmacies from payer networks. So those are worst case scenarios, but again, the legislation is being looked at to try to prevent that from happening. The one last point that I want to make on this slide is that, you know, the careful consideration on what the process will require from involvement with the organization, and do you have the resources to effectively manage the process, and will the recouped savings outweigh the efforts enough to make it worth it? I think what we'll show as we go forward here is that the resources that you regain are significant in many cases. So it's going to be an exercise that your organization will have to do, but we'll talk in more detail about this in further slides. So as I mentioned, the ESP Terms of Use Agreement is something that you should really take a close look at, and just take a look at some of the highlighted text that we have here as a brief example. You grant Second Sight a worldwide sublicensable, non-exclusive, royalty-free, perpetual, irrevocable license to collect, process, disclose, create, derivate, create derivative works, of and otherwise use the covered entity claims data. This data license survives after termination of the agreement and shall survive as to any covered entity claims data that you have submitted on behalf of the covered entities and so on. So you can understand why when I say it's very one-sided, it certainly is. And when I mentioned the term extortion, and that was a term that an attorney had mentioned in one of his presentations that I sat in on, quite a while ago when this was being proposed. I think that's the only way that an agreement like this could actually, be accepted by entities, because what you need to really weigh is what the value is of getting that information or the access to your 340 benefit back. So again, legal review is highly recommended. I would definitely say that the entity should have their attorneys look at this agreement and then go from there. We have not seen any global acceptance of red lines that are proposed on these, but I always will also recommend that it is best to actually send red lines back in any contract from your attorneys, determine what you're willing to accept from a risk tolerance perspective. But also, if you don't ask, you will not get any adjustments on an agreement. So I highly recommend that your legal team reviews it, red lines, and then goes from there. With that, I'll turn it back over to Beth.
Thank you, Jim. So once you've decided to move forward with ESP, whether you are designating a single contract pharmacy or sharing data, our dedicated reps will need the details associated with the agreement. So that would be similar for other vendors. You'd want to let them know the details related to the agreement. So you'd want to provide the manufacturer information, the effective date of the agreement, and what arrangements the agreement is applicable to. So what pharmacies, stores, etc. With these details, we will remove any qualification or replenishment blocks internally, and we'll also communicate those to partners, such as a gateway. That will allow us to get replenishment turned back on, and we'll manage all those details and maintain records of them, so our wholesaler team is able to have the awareness if 340B pricing is not extended. If an agreement is in place, our wholesaler team will reach out to the wholesaler to correct the pricing if it wasn't extended. If an entity is submitting data to ESP, we'll work together to structure a reporting schedule. Our CSA would provide that report in line with the schedule moving forward. And once the entity receives the report, they should upload it to ESP by the 1st and 15th of each month. And Hudson 340B is working to directly integrate with ESP to alleviate our clients of this responsibility. And we'll also be adding the initial pre-approval report and the ongoing data submission reports to our client portal, so they're available ad hoc as clients would like them. So when you're submitting data to ESP, as Jim mentioned, it's important to keep in mind that ESP is looking to prevent duplicate discounts to manufacturers. Their definition is inclusive of all discounts. It's not limited to Medicaid, as we're required to exclude by the statute. So to designate a single contract pharmacy or share data, you have to register with ESP. There are links at the end of the slide deck, which will point you to the correct website. And that page will walk you through the steps to register either scenario. So your designations take place in the entity profile area in ESP. Once you're logged in, you confirm the terms and assign the designated pharmacies as you're electing them. Once the selection is saved, the designation should be completed. The user should receive a confirmation email. It's usually or scheduled to be within 10 days of submission. Once you receive that, you should be able to begin purchasing or resume purchasing. That is, of course, in theory. Sometimes the wholesaler doesn't have the 340B contract yet. There can be some communication needed between the entity, the wholesaler, and ESP to get your pricing reinstated. When you're moving forward to submit data, the process is similar. The data has to be submitted for those designated pharmacies. ESP reviews the data and will provide notice once the approval is completed, and again, purchasing can resume. And then data needs to continue to be submitted twice monthly to maintain your pricing. If you miss an upload, the approval process may have to start all over again. So it really could reset your clock. So here's an example of our Hudson 340B report that is provided to clients to submit to ESP. It contains all the necessary information. The report does contain all manufacturers. So if an entity is only working with one or two, you would want to remove that extra data. And again, this report would be issued twice a month. The entity would upload it to ESP, and it will be available on our portal, and the direct connection will be happening soon. So Rachel mentioned earlier the wholesaler piece of pricing. So as an included value-added service, Hudson 340B has always reviewed pricing extended by wholesalers and facilitated outreach on behalf of our clients to have those discrepancies corrected. This slide paints an ugly portrait of the times. Before manufacturers began in 2019, incorrect pricing happened, but it was also able to be corrected timely, and it was minimal. When we look at the portion for 2022, we have 18 manufacturers applying initiatives. The pricing is chaotic, to say the least. Wholesalers often don't have the contracts in place. As I mentioned, it could be a missing communication between the manufacturer and ESP, ESP and the wholesaler. It's really a mixed bag. And we've also seen pricing be available for a length of time and then suddenly it's missing. Wholesalers, in our experience, haven't upped their staffing yet to help accommodate this turmoil, which has resulted in credits taking much longer than we've seen historically. Some of the responses that we get are now in the 6-week range, where it used to be within a week or two. So it's really impactful for covered entities. And a notable experience we had recently was that a wholesaler hadn't even heard of ESP yet. So if they're not aware of it, it makes it even more challenging to know the different channels that they have to go through as well. So our wholesaler team will continue to monitor and request corrections of incorrect pricing. But again, there is that financial burden for covered entities while pricing is corrected. It's important that covered entities review reporting, both of ours and other vendors, to monitor and address any concerns.
So we completed an interview with some of our clients, and we wanted to share their thoughts and experiences with all of you. So participating with ESP doesn't stop at loading the data twice a month on the ESP website. This task really only takes about 2 hours a month, depending on the number of arrangements that you're supplying the data for at ESP. Tracking and facilitating follow-up conversations with ESP manufacturers or wholesalers can take up to 20 plus hours per week. You may risk a loss of pricing eligibility with ESP or manufacturer if the data submitted doesn't support the purchase volume. So for an example, this client gave us, if 10 packages were submitted in the dispense data, but 20 were purchased, the data doesn't support the purchase volume. So you wouldn't get pricing on all 20, you'd only get pricing on 10 of those. Covered entities have pointed out that needing oversight on pricing and accepted data reports is necessary to ensure pricing is being extended and exclusions or exceptions are in place correctly with all TPA and gateway vendors. When reaching out to ESP service support, the response time has slowed compared to the initial start. We believe this is because there are more covered entities that have decided to start submitting the data. Now the response time is more than a day. It used to be less than a day or within a few hours. Now it's closer to a week to 2 weeks to get a response. This isn't saying it's bad service, it's just awareness of the complexity. Response time may also continue to grow as more covered entities decide to submit. 340B pricing contracts have been in place one day on wholesaler websites and then removed the next day. It's a difficult process to get the wholesaler to load the contracts, again, due to miscommunication and understanding at the wholesaler level. Sometimes wholesalers don't know why the pricing even disappeared or how to get it back quickly. Data submission requirements and monitoring the restoration of pricing forces covered entities to redirect staff and resources. I'm going to turn it back over to Beth.
Thank you. And before I forget, I'm going to share a poll to gauge who is or how many people are submitting data. So feel free to answer. Your name isn't shared externally, so it's helpful for other entities to know where others are standing. So additional feedback, entities should report voids or reversals in their data submission. By not submitting voids, it could result in PBMs not getting the rebate, which further aggravates the environment. So there are reports out there that don't consider the voids. ESP terms of use impose many legal and financial obligations, burdens, and risks on covered entities. Submitting data is completely unregulated. There's no oversight by HRSA. It's been regarded as the fox guarding the hen house. The reality is that the restoration of 340B pricing for multiple contract pharmacy locations is not as simple as just flipping a switch. And the last feedback from clients was if exclusions are in place with a TPA, but data is needed by ESP to restore pricing, we run into the chicken versus egg scenario. Hudson 340B does apply all eligibility filtering, with the final piece being on manufacturer exclusions. This is something to consider with other vendors. If you're submitting that pre-approval data, understanding how they're filtering or landing on what you're submitting is really important. If data assumed to be eligible in that pre-approval file doesn't end up being realized and going through 340B, you'd want to manually apply reversals to those files, to those dispenses in ESP to, again, prevent those missed PBM rebates. So we're going to take a look at the poll. So about 12 people are submitting data. We have 25 not submitting, and we have a few that are in progress to begin. So more heavily on no today, which is interesting. I think the last time we gave it, it was more heavily on yes or in the process. So it's interesting to see the different areas where people are at right now. So we're going to jump into the Q&A session. As Jim mentioned, we did pull these yesterday morning. So if you registered after, we may not have added your questions yet. Feel free to submit them through the chat.
Hey, Jim, you're muted.
I have to do that at least once every webinar or every team meeting, so I apologize. What I've started to say was that we've had some really good questions coming in through the chat already, but what you'll see is we have a really robust group of questions that came in over the registration period as well. So let's get right into it. The first question almost seems obvious, right? How can submitting data to ESP help our program? Well, as we're seeing with the poll response is that there are more reluctant organizations on this webinar today than there are those who are submitting. However, if you take a look at the financial impact of not submitting and look at what's being withheld from your program and anticipate that you may not get that benefit back, that is how the ESP submission can help your program, is to regain those 340 benefits that are yours to begin with, but you're not going to get unless you do submit at this stage of the game. The funds, obviously, that you're missing can be used for patient services. If you're unable to supply critical services to some of your patient population because of the funds that are not being shared with you because of the ESP submission process not being not taking advantage of that, then that's something to weigh in as well. And one part that I think is important to understand is that if you have a sliding fee program and you have patients who are using some of the drugs now that you don't have access to because of the manufacturer restrictions, and before you were passing along 340 pricing to those patients, you need to have other alternatives, or you're going to have to subsidize a much larger expense on those medications. So take a look at your formularies and things in that area as well. And just, I think, pay close attention to what the risks are versus the regaining or reward of actually submitting the information. And then the one last point I'll make is that if you do choose to submit, I would document in wherever possible, first of all, that you're doing it under duress, that you're not a willing participant in this process. Whether that will help you downstream or not, I'm not sure. But if you don't acknowledge that, it could be determined that you're doing it as a willing partner. The other part is keep track of what you're losing by not submitting this data to ESP. And there's a tool, an Apexis tool that's available to help you keep track of what you're losing that you should be gaining access to. And that's one of the handouts as well.
Yes, I just added that handout for ESP terms of use and the pricing form for Apexis. And I also added another poll based on requests from the chat. If you are submitting data, are you a health center, grantee, or a hospital?
Okay. On the next question.
So another question from the registration was, how do I designate a single contract pharmacy? So we touched on it a little bit. There is a link on the last slide that points you to the correct site to do that on ESP, and it will walk you through the steps as seen in the SNP.
I think I jumped ahead on, there's another question prior to that. There we go.
Oh. Okay. So that's for that. How do you get access? You can use the link at the end of the slide deck to register on ESP. Same for how to designate a single contract pharmacy. And then what are the data elements? Here's a snip from the ESP website of what they're expecting. There was a question, I can't remember if I made another slide for it. If you need to submit the wholesaler invoice information, there is on the ESP website, there is a mention of it, but given that entities are providing dispense level information, not purchase level information, you generally would not have that invoice information available.
So the next question is, how do you obtain a HIN number? So a HIN is registered through HIBIC, and it's supposed to help identify a bill to ship to relationship between the covered entity and a contract pharmacy. This would allow access to 340B pricing. Some wholesalers obtain HINs as part of their process, but not all do. If a wholesaler does not have one, the covered entity may need to register one through HIBIC. Some pharmacy partners have also offered to purchase HINs on behalf of our clients as well. It's always a good idea to connect with your TPA before you purchase a HIN to double check if it actually is needed.
Let me add one thing on that, Rachel, because there was a question that came in on the chat regarding the HIN. Is it a HIN for the covered entity or is it a HIN for the pharmacy? And what we're understanding here is this is a separate HIN that identifies that one-to-one relationship when you're identifying a single pharmacy. So it is a different HIN that you're going to have to obtain in these cases, not just your healthcare organization's HIN.
Thanks, Jim. I'll pass it back to you,
Okay.
Jim.
So is submitting data worth the time investment? So again, this is participating with ESP doesn't stop at loading the data. And in many cases, and in our case, we are working with ESP to have a direct upload process so that we can offload that from the entities and avoid the middle step. We'll take the data directly and upload it if the entity wants us to directly to ESP. However, the tracking, facilitating, and follow-up conversations with ESP manufacturers and or wholesalers can take up to 20 hours a week. Also, you're going to need to consider oversight on pricing and accepted data reports and ensuring that pricing is being extended and exclusions or exceptions that you have in place are also working accordingly. So how do you assess this? It's really an expense versus benefit exercise, hours, manpower, et cetera, against what the benefit is that you're going to regain from the process. And in most cases, we are seeing, as I mentioned before, it's substantial. And one of the questions that we'll have is how much money is being lost by entities, and we'll talk about that. So are there legal or HIPAA concerns surrounding submitting data, and who's liable if there is a data breach? Well, if you take a look at the terms of use agreement, there are definitely concerns about uploading the data. The HIPAA concerns are somewhat mitigated according to ESP because they encrypt the data. They have de-identified the data. They've removed most of the fields, almost all of the fields that would be patient identification fields. However, the script number is still a field that's in that file. So work with your legal team and determine if that's a patient-sensitive field of information and you feel comfortable sharing that data. But what you'll see in the one-sided agreement is that the liability will rest with the entity. Sole liability for any breach of that data is gonna rest with the entity, which is something to consider. Now I'll turn it over to Beth.
So questions of which manufacturers have been easier to work with or more challenging. So given the landscape, we're hearing very different experiences for mostly everyone. And we haven't quite nailed it down if it's due to the entity size, the particular maybe wholesaler, timing of ESP. We haven't found that pattern yet. But each drug manufacturer is different. Their approach is different. Their rules are different, and the entity types impacted are different. So there are a lot of layers. We have heard one piece of feedback was that different manufacturers are approaching the 45-day more strictly or more leniently. So we have heard that Eli Lilly is very strict with that 45-day dispense window, meaning that anything outside of that would be immediately denied, where Sanofi is a little more lenient with that rule. So how do you submit a reversal on the platform? It's the same as a dispense. You would just submit it in the appropriate timed file for that time frame.
So the next questions are there any tips available to ease ESP submission data? How do we track confirmations? How do we track the 45-day replenishment? So a tip that we found helpful is to identify if your TPA can directly integrate. This will save time for each client submitting. If your TPA is not able to submit on the covered entity's behalf, ensure your TPA's report is easy to submit before starting this process. You want to be able to understand the report you're submitting to ESP before you move forward. The confirmation colors. So when a report is submitted to ESP, there's specific colors that populate. Blue was identified as claims that have been accepted and can be replenished. White are claims that are not needed to be submitted. This is due to not all NDCs being blocked per manufacturer. And then red identifies that the NDC does not meet the criteria. This could be identified as a duplicate discount claim and should not be replenished. The problem is that we don't have insight into this. This is what it's outlined. It doesn't tell you why it was declined or you're not able to replenish it. The 45-day replenishment tracking. So your TPA should have a mechanism in place to consider the timeline. For us at Hudson 340B, we created technology that applies a 45-day window to the fill date of this date submission that has not had pricing rejected yet. This may be a joint effort between the covered entity, TPA, and contract pharmacy to ensure the data is submitted quickly and timely. Each manufacturer does create their own rules and can change them. So another tip I thought of yesterday while I was doing a little bit of research is To make sure ESP is in your favorites, they will update their letters without even telling you that they've updated their letters. So when you're, maybe once a week, you should set aside time when you are submitting or you're choosing to submit to review the letters and see if they've changed since the previous week, because we've also seen that as well. They may add NDC, they may change them, they may change their 45-day window. It really is up to you to make sure that you're on top of it. As a TPA, we do our best to also do that on behalf of our clients, but it is just to make sure that your TPA is doing that on your behalf is really important. I'm going to give it back over to Beth.
Are the NDCs listed on the 340B ESP's website the best list to work from to know exactly which NDCs are affected and how often are they updated? So for those manufacturers that are contracted with ESP, the ESP resource for the NDC list is the most effective way to track the list. For the two that are not using ESP, they have NDCs on their notice, but their notice can change and not be publicized. So if it's really important to watch your pricing, if you see a new NDC not have pricing extended, you need to follow up on that. And if it has been added to the initiative, you need to put the measures in place to prevent those or start submitting those NDCs to ESP if you're submitting data. Rachel mentioned that the notice page does have a date parameter on it for last update for each notice, which is really helpful. At last check, the NDC portion of the ESP website did not have that. So it does require a little analysis to make sure the NDC list that you have is up to date compared to what is on the ESP website.
Okay, as an FQHC, ESP would not allow us to designate a single contract pharmacy because we don't have our contract pharmacy registered under each site, only under the parent entity. Is that right? This is a good question. And, from our perspective, we recommend that the contract pharmacies are listed under the parent site only. The contracts are with the parent in most cases, and also it doesn't exponentially show multiple contract pharmacies that are really duplications on the OPACE database. So even HRSA has recommended that the registrations for the contract pharmacies be listed under the parents. So I think this may be an education issue with whomever you were speaking with at ESP that said that you couldn't register those pharmacies and then direct them toward the parent site registration listing on your contract pharmacy list and go from there, because we do know specifically entities who have listed all their contract pharmacies under the parent site who were able to designate a contract pharmacy for a child site where it wasn't specifically listed. So I think it's an education issue with whomever you were speaking to at ESP.
My favorite question submitted, can we make it go away? If it was in our power, it would have stopped on the very first day that the very first notice went out, and we would not be having this webinar today.
Okay, so this is a question that I referred to part of it earlier, but I want to make sure we cover it. It did come in, and it's a good question. It's a multi-part question. So how close are we to a resolution by the courts or by Congress on the manufacturer restrictions? That's a very difficult question. We know there are multiple, veins of legal challenges from both sides to try to, correct and remedy the issue. I know there have been very pointed letters from Congress, but to say how close we are to a resolution is something that I really can't say. I do think that it's kind of somewhat stalled in the courts. I think that midterm elections can kind of stall things, and then we can see what happens after that. But I don't think it's something we're going to see by the end of this year. And again, this is just my own opinion. I do think that there's going to have to be some heavy work on this in Congress to make strides to try to protect this. How long can any one entity keep putting off submitting to ESP? This question, as I'll go back to our intro, it's really entity specific. I know small entities who are at risk of having to, shut their doors if it goes much further. They have some tough decisions to make as far as submitting data when they really would prefer not to. But as I mentioned, they get backed into a corner and they have to run it by their board and then make a decision to submit data. So it's really hard to say how long any one entity can put off submitting. It really is an individual decision. So the question that I did reference loosely before was approximately how much money is being lost by health centers or hospitals. So I did a little bit of researching, and what I could find is that 340B Health, specific to hospitals, did post a survey of more than 500 of their hospitals. They conducted it in November and December of 2021. And they found that most urban 340B hospitals already have lost an average of 23% of their savings that they had been obtaining through community contract pharmacy arrangements before. For the critical access hospitals that are so critical to the care in these rural communities, very similar to FQHCs, those losses average 39% for those entities. Those figures translate into significant monetary losses for the patient care budgets of these safety net hospitals. For the mostly urban hospitals, the median loss of resources was $1 million. And more than 10 of those hospitals reported that the drug company actions have deprived them of upwards of $9 million. The median loss for critical access hospital, and keep in mind, they have a much smaller operating budget, was $220,000. And 1 in 10 of those hospitals lost more than $700,000. From an FQHC perspective, I do know that there was a posted article in central New York where 6 federally qualified health centers across that region posted a loss of $250 million because of this. So if you extrapolate this across entity types and across the country, it's in the billions. So it's not an insignificant impact on the healthcare safety net.
So the next question is, none of my TPA's report for ESP upload contain invoice numbers yet. The ESP website says they are needed. Are they? So the data needs to be submitted to support the purchase, making the invoice number likely to not be available before or while submitting the data. We've had clients submitting for some time without the invoice number, and they have not had any issues so far. We continue to monitor that closely. And then the next question, transferring to a different contract pharmacy, how to re-register with the ESP. So it's the same process as going to the ESP site to make the single contract pharmacy designation. Each drug manufacturer has a different timeline for when you are able to redesignate another pharmacy. Most are around a year after their original designation. You'll follow the same exact steps for the manufacturer you want to change, and the approval process is the same as the previous year. You will receive the confirmation of the pharmacy designation, and the platform updates the designation. It is important that if you do change your designated contract pharmacy, that you communicate that with your TPA and wholesaler to notify them of the change and make sure that you are continuing to get the correct pricing for the different pharmacy. So now I think we're going to open it up to the actual questions in the chat.
Yes, and before we get into the chat, the polls, if you didn't submit an answer, you can't see the results. So if you're submitting data, are you a grantee or a hospital? 61% of those are health centers or grantees, and 39% are hospitals. And the first question, are you submitting data to ESP? 27% say yes at this time, 68% say no at this time, and 5% are in process to begin. Okay, so going through the chat, the slides are available in the handouts. Does anyone know if the price conditioning is applied to these major manufacturers as parent companies or subsidiary companies? So it can be the parent or the subsidiaries. The NDC list would be most helpful in determining which NDCs to consider. I know you cannot provide legal advice. Suppose a covered entity engages terms of use decides not to proceed, does this give second site ESP the right to claims data not yet submitted?
Yeah, that's a really good question, because if you do read the agreement, it gives them unlimited rights to the data. So if they're going to continue to get data from the switch or whomever on your behalf, could they still use it even though you're not submitting data? I think that what I would suggest in that is that if you're going to decide not to submit data, that you send a letter specifically and document a termination date of your decision, so that you would have recourse after the fact, or and then how would you know behind the scenes what's happening? But if you're not submitting the data, they shouldn't be able to use the data from your pharmacies.
Besides providing this analysis, which I'm assuming was from the slide where we showed when a new manufacturer joins and we issue a 6-month analysis, do you then serve as a TPA or work with the covered entities TPA currently established? But then there is add to that. Maybe it wasn't to that. That's a separate question. Okay. So that report is issued to our TPA clients. We wouldn't be able to issue it on behalf of other covered entities because we wouldn't have the data to support the analysis. And I did say that we're working to integrate with ESP directly to submit on our client's behalf. If we elect to submit data, will a new agreement or contract or line of purchase be required between the wholesaler and the covered entity?
So I can answer that one. So no, as of right now, that is not a requirement. We do need to just communicate between the wholesaler and your TPA that you are submitting data, and they should be taking care of the rest.
Let's see. Lori had a good point. There are only 7 pieces of required information in the ESP submission, though there are several other optional pieces, and their covered entity only submits what is necessary, which is a good approach.
Yeah, I'm glad you jumped on. I was going to talk about that as well. I think that that's extremely good advice. There's a myriad of different fields out there that look, like if you don't pay attention, that you're going to fill the whole thing in, or your TPA is. Be careful only to provide what is absolutely necessary.
Simply put, what services and benefits would Hudson provide? So the intent of this webinar wasn't necessarily a sales pitch. It was to try to help the environment. There are a lot of moving pieces, and the knowledge base is different with each contact that you work with across the environment. So we just wanted to help make the entity stronger and armed with more knowledge to approach the environment. So I don't know if there's a follow-up to that, but feel free to add to the chat.
Yeah, and I think that we discussed some of the things that the Hudson Headwaters as a TPA does provide. Proactive approach as much as we can on behalf of our entities. Navigating the space across multiple entities that are actually submitting data helps everyone, because we learn from the difficulty or the progress that some entities will make, and we help navigate that space on behalf of our clients to help them have a smoother opportunity as well. But if anyone wants to know more about what we do, they can contact us directly. We'd be happy to talk through all the services that we provide as a TPA, consultant, auditor, and so on. So feel free to contact us directly.
There is a comment in here that says my client manager at our TPA doesn't know what a HIN number is. So speaking from the client relations side of things, we make sure that our CSAs are knowledgeable about everything. Our response is always going to be the person or contact that has the most information to help our clients. So we continue to educate, we continue to train and make sure that all of our CSAs know what they're talking about and can support our clients the best way as they work through this really confusing situation.
And if they don't have the answer, somebody here does.
100%.
Let's see. What if every covered entity tracked these losses monthly on a monthly basis and flooded HRSA with the losses?
I think that that's the intent of the tools that are provided by Apexis, is to keep track. I do think that there's more than enough information flowing that way. I think that they're hoping they can use that as evidence and a strong argument as far as how to protect this program. Because if you keep in mind how much money is being withheld, excuse me, from the safety net, and let's say that it doesn't get remedied, that's a vacuum that has to be filled eventually. I think that, healthcare as we know it on the safety net side of things is really going to be impacted to the point where it has to be, patched together through other sources. And I don't think that the, HRSA or anyone else is going to be prepared to do that. So I think that the evidence, excuse me, go ahead, Beth.
Sorry, go ahead.
Oh, please.
I was going to say, probably having that analysis available and sharing that with your local legislators to hopefully get some progress in the courts would probably be a significant help to show, the dire place that we're in currently.
I think the louder you can be about this, the better. Just to show even your communities how impactful this is regarding, having the best care for the community is being impacted because of this. So making sure that you are loud, that you are contacting your people who are in charge of monitoring this is really important.
Yeah, advocacy is extremely important to protect 340B in all aspects of the program. Now more than ever.
And for hospitals, 340B Health, for health centers, NAC, they both have really great resources to help start voicing this information, and they each have a different approach and kind of plan of attack, so to speak, of how to get your voice heard and who to contact. So excellent resources there if you're willing to help advocate.
So one question I do want to address, because I think it's a good question. The question came in as, is there a fee or is there a charge from ESP for using their software? I think the question should be, do they pay entities for this valuable data? And the answer is no on both. There's no fee on their side, but there's no reimbursement for sharing or giving them something of great value either. So again, the value that you're getting back is yours to begin with. So keep that in mind. They're not paying you for the data. You're just getting back what you're rightly entitled to.
It could be interesting to see what ESP is getting from manufacturers for the platform, but that's another talk for another day, I suppose. Comment patient stories, experience, impact is key, and please let NAC know of those. Are we submitting data currently for clients or working to create the process? We are working to integrate with ESP, so we're not there yet, but it's in the works.
Very, very soon. All right. Any other items that came in on the chat with 2 minutes left to go that we did not address that we think we should, Beth? Or
and while we wait for any final questions, the last slide in the slide deck that's in the handout has all the links that we referenced, so that could be a resource for you moving forward.
I think there is one question we missed. Is there a website that has a list that shows all entities that are sharing data to ESP? No, not at this point. They're keeping that close to their jackets and making sure that, nobody really knows what's going on. So when they are commenting or, you just don't have the truth behind it. So no, there is not a website that shows you who is.
Yeah, and as an entity, you may not want to have that disclosed either. I mean, it's a tough decision to make. I mean, we do know that there's a lot of push from certain organizations to not share the data, and we understand that. But again, each entity has a very, very tough decision to make. So you may want to do it and know that you're doing it in somewhat of a not anonymous way. That's all. Anything else?
I think that covers the chat, covers our slides.
All right. So with that, if anyone has any questions for us or wants to contact us directly about services, please feel free to do so. Our website information and contact information is here. It was a pleasure chatting with you today on this Friday morning. And hopefully that, I know we have representation from all over the country. So if you have a baseball team like up in Seattle that you're rooting for, we're hoping that you can advance to the next stage as well. So we'll be rooting for our team here in the Northeast. So happy Friday and thank you for attending.
Thank you.
Thank you.